help us serve clients in that environment. And particularly Laura, the California wildfires, many of those responses in 2020 proved quite challenging for the organization and managing that change management. As we headed out into last hurricane season, we obviously had Hurricane Ida and again a series of California wildfires. In that shift, you saw us again make another change, right? We moved from a predominantly NCS environment in the 2021 season, or sorry, the 2020 season, to a predominant congregate environment in the 2021 season. And so as we've gone through the last 2 years, we're really trying to identify those changes that we've made that are going to be successful to help carry us through into 22 and 23. So, for example, Kentucky tornadoes this past December, we utilized a similar response tactic that we used in Ida, and utilizing what we call the IDADs, which are itinerant OM personnel that went in, helped the leads at headquarters see into shelters and talk to clients, understand our service delivery. So we're currently evaluating that structure to have inclusion in the ConOps moving forward to understand, was it successful? Did it really provide better service? Did it help our leads and the DERA headquarters perform their functions and tasks? We saw many changes in virtual responders. So I would say before the pandemic, we struggled to engage virtually on national operations. We've seen it handled very successfully here in the last several years, and we're going to look to leverage that as we move forward, whether it's through SRT work, through support and planners, through damage assessment. And so we're going to be looking to implement many of those changes as we come out of the pandemic over the next several years to ensure that we're able to best utilize people who may not be able to deploy full time, but may still have the time and willingness to give to the organization and to our clients. So you're going to see us make some shifts in that virtual environment. We're not going to go as far and as drastic we did at the beginning of the pandemic, where we went to an almost fully virtual environment, but we're going to see some opportunities arise for volunteers who want to give but don't have the ability to deploy physically on the ground. So you'll see that coming up. Several other areas you're going to see some updates here. I know we had an email from Gail 2 weeks ago about mask mandates and vaccination mandates. So as we come out of the back of the pandemic and move to a more endemic environment, we're going to really be evaluating what does that mean for our clients. You'll probably see in 22 us shifting much more to a normal service delivery model. You'll probably see us adjust square footage again, adjust some of our requirements around masking to align with the public health guidance that's out today, and really trying to get ourselves back to a new normal and really make sure that we're able to drop back and increase service delivery to levels we saw pre-pandemic. So you're going to see us really try to go through a change management process here over the next few months, where we're really going back to a new normal and helping people guide themselves back to what does that really mean and how do we serve clients who are in this sort of new post-pandemic environment. Obviously, there's a lot of things that go into that. We're going to have to continue to monitor and watch for outbreaks, new variants. You may see us have to go back into certain pandemic measures as we head into 22. So I would say 22 is going to be a little turbulent in regards to change management, because we're going to start shifting back. And if something changes, we have a new Omicron variant or Delta variant, right? We may have to shift our protocols and increase our safety measures to respond to it. So our ask is what we always ask, right? Flexibility. We're really trying to make sure that we're making the best decisions for the client and our responder safety, but also making sure we can actually provide the services, right? We don't want to get to a point where we can no longer provide service to our clients. So you'll see that occurring. Some other changes heading into 2020, I guess FY23. Many of you may have heard of the Mission Adapt program led by Ann Palmer at National Headquarters. Our goal here is to go into high-risk communities, as Adam mentioned, communities that continue to have repetitive loss. We've seen Louisiana hit the last 3 years in a row with the hurricanes, Northern California continually hit by wildfires year after year. We have a lot of very vulnerable communities that have repetitive loss year after year. And so we're going to be looking to change some of the ways we provide services in those communities. A lot of this has to do with increasing the staffing footprint before a disaster to help increase partner capabilities in those communities, right? So going in, helping small church food banks and food pantries increase capacity and resilience, so when the disaster happens, the food bank doesn't shut down. So this is really about how do we connect and manage the impact to clients and return them back to their normal as quickly as possible. I believe it's less to do with some of the changes immediately to our service delivery. While we'll see some of those through time, it's really about how do we go into some of these high impact areas and help community partners, local community groups who have direct access, and we're calling kinetic partners, groups that have access to the clients already, right? So we're not going in there and looking to fund partners who are going to come in with us during the disaster. This is about taking the community organization that didn't realize they were going to be a disaster response agency when the disaster started, but is now one because they're in their community. And how do we help give them the tools and the resources to help them respond in their community? So we'll have a lot to come with Mission Adapt over the next several months and years. We have funding now to pilot a program across 5 communities in the country. So we're going to be increasing staffing in those areas and really looking to help engage and support community growth across those geographies. When we look to readiness, we have a new readiness manager we'll be looking to hire at national headquarters to support the growth of the national readiness target and regional readiness targets. As Adam mentioned, we're seeing continuous repetitive loss in many communities across the country. We're moving from an acute to chronic environment where we're having more and more responses, more and more larger disaster events. And that's not just level 7s. We're seeing level 4s and 5s increase across the board, and that's a significant drain on the organization's resources that have to continue to respond to these events. So we're going to be looking to update and shift some of our resources to help us build capacity and growth while also building capability. So are there other strategies we can employ to provide the similar like service to clients? Can we do different things in shelter resident transition to shorten the time people are really in shelters? Not only to help manage our resources, because the longer they're in there, the more resources, human resources we have to expend to keep them there, but it's also better for the client to transition into some other housing solution. So we're looking to make investments in those areas to help people transition quicker and make those adjustments to programs to better utilize our resources and become a little more efficient in service provision. And the last thing I have on my list as we head into FY23, MassCare at national headquarters is going through a program review right now. And what that really is we're taking a holistic look at the MassCare program, sheltering, feeding, DES, reunification, and really asking ourselves, why do we provide the service? What is the impact that we expect to make on somebody's life by providing the service? And the reason why we're going through this is, I'll use distribution of emergency supplies as an example. Why do we give out a shovel? What's the intentionality behind it? And is that the best item to get the impact we want to make? Cleanup kits. We give out a ton of cleanup kits across the country, significant amounts of them. Does a cleanup kit really keep somebody in their home, or can we adjust the items, the product, to really make a different impact in someone's life? So we're evaluating from top to bottom the MassCare program, looking at why do we want to make the impact, or what impact do we want to make? What are the activities we're doing today to try to make that impact? Are they being successful? And then we'll look into FY23 for, do we need to make some adjustments in different programs, whether it's feeding or DES? Do we need to change nutrition standards or the type of food we provide to better serve the clients of tomorrow? So going through that process now, we expect that'll take us the next few months to go through, update what we're calling the theory of change, go through and reissue the new MassCare program essentials document, and then look to update our standards and procedures for all MassCare over the next 2 to 3 years. So our real goal here is to provide a roadmap, a 2 to 3 year plan for MassCare doctrine. Our goal is to provide that openly so you all can see what's coming out and what the timeline is. Nothing should be a surprise. So we're going to really try to increase the transparency in the program around what is the doctrine, where are we going, and where are we driving, so you all can be successful in implementing the programs as they come out, and training and building your workforce. So that's really the spiel. Ari, I know I'm not sure how much time you wanted to have, but I figured I'd give some buffer. I think I had 15 minutes, so I got about 4 or 5 minutes left for questions if anybody wants to ask a question, or we can go from there.
Yeah, that'd be perfect. If anyone wants to throw something in the chat, a question that you might have, especially with this whole focus of looking forward towards really improving and evaluating what the programs are, put your chat in there. I'll give everyone a minute, or you're welcome to raise your hand and we can call on you. Well, I'll ask a question, Chris. How is it measurable, the amount of impact the shelter resident transition program has had? Have you been able to see like a comparable change in the length that shelters remain open with the new program in comparison to years where it wasn't present?
Sure. So right now we're really looking to evaluate that. I would say yes. I would say that we are seeing measured and marked change in people's ability to transition out of shelters. I'd also say that sheltering, when you look at 10 years ago, sheltering and sheltering today is very different. We're seeing much more vulnerable populations. Their ability to transition is much less. Housing stock is few and far between in many of these communities. The money and socioeconomic status of many of our clients and their ability to recover on their own is greatly deteriorated, especially in areas where they're having year after year loss. People can only take so much, especially when they are losing their jobs and losing their homes from these disasters. So while I believe shelter resident transition is helping to lower the amount of time clients are in shelters, we're also seeing an elongation of the actual shelter period as a result of other community factors. So it's really two competing interests, right? If we didn't have shelter resident transition today, we'd probably still be sheltering people from Hurricane Laura. So a lot of these factors are in play. We have a lot of new strategies. We're evaluating how much money do we give out, for example, in shelter resident transition. The standard dollar value today is about $300 plus that exemption process, which gives you up to $1,500 total. We're seeing an average case is probably closer to $600 to $700 to help effectively transition someone. So we're really trying to look at how much does it cost to help someone transition? Are there other partners we can bring to the table to better transition somebody? Getting people connected faster into FEMA or other state programs. So I'd say yes. I'd say we see the program today is very successful, but there's a lot of opportunities to grow and transition people quicker out of those programs.
Awesome, thanks. I know we're coming up, but would you be willing to give just a few more minutes? There's a couple of questions in the chat.
Yeah, absolutely.
Hank asks, feeding still uses individual packaged meals versus meal off Cambros. Do you see that changing in the short term?
Yeah, we actually adjusted it in the last COVID compendium update, and you'll see it in this one as well. So we're no longer requiring individually packed meals. We still ask the normal safe food handling procedures, the cleaning of your hands, the wearing of gloves, right? All of those factors allow for a safe environment in the current pandemic. So we've transitioned out of the requirement around individually packaged and have gone back to normal Cambro feeding or mass feeding as required. So we have made that shift already, and you'll see that in the next compendium update.
Thanks. Elizabeth asks, are we making the assumption that COVID will be part of all future planning? Or is there, I guess, a point in the future where you guys will assume that will not be part of operational planning?
Sure. I think what you'll see is the COVID is not going away, right? When you look at the chance for us to eradicate COVID is gone at this point. So what we're really going to try to do is adjust our program so that we take into account COVID, just like we have to take into account flu or other viral outbreaks in communities. And so you'll see us make a shift really around what to do when there's an endemic response required due to this kind of disease. What are the other things we can do? 80% of the country is currently vaccinated. And so that vaccination level allows us to do certain things now that we couldn't do a year ago or even 2 years ago. So you're going to see us do some shifts in program to help factor in the fact that there could be endemic situations in which we need to increase protocols. But I think what you're going to see is it's really more of an outbreak by outbreak kind of response as opposed to flat across the board in planning assumptions. So it'll be with us for the long term now, and we'll just have to factor it in as part of a standard program procedure. So
appreciate that. One other question from Diane. Knowing that mass care is moving from acute to chronic, where do you see the most need for volunteers?
Sure. So Diane, I'm actually going to answer your question a little differently. I see the programs needing to shift how we provide volunteer opportunities in the future. So it's less about what activity needs the most volunteers and more about making it so we lower barriers to entry into our programs. It doesn't take a whole lot of training to pick up boxes and hand people supplies, right? It takes minimal training to serve meals. We need to make sure that we're lowering the entry into the mass care program so people have better opportunities to volunteer. As we look at younger generations, many of them want immediate impact, minimal training, and they want to be able to go out and so we're going to have a workforce that's going to shift from a career kind of volunteer or volunteers that give more time to volunteers that want to basically pop in and pop out of the organization as required. And so we're going to have to change the way we train our supervisors and managers to deal with a more itinerant workforce. We're gonna have to make sure that they get the training they need to do the job and the job tools they need to do it without expecting tens and hundreds of hours of training to do it. So we're gonna have to look at all those factors and how we provide the tools to our workforce to allow them to volunteer and keep the levels we have. So I think the workforce of 10 years from now is very different from the workforce today in regards to their expectations of the Red Cross in their engagement. So we're going to have to make some shifts here to help ensure there's better access to programming, easier access to programming, but still providing the quality service that we expect of the Red Cross.
That. Any other questions that anyone has before we let Chris go? Well, Chris, thank you so much for your time. I know you're busy. I know you have a lot of things going on, but it's great to hear from you and hear all the things that are going on. So again, thank you.
Great, thank you, and thank you for having me. If anyone has questions, feel free. Ari, if you want to gather them at the end and shoot me an email, I'm happy to, as you go through breakout groups, if things come up, just send it our way and we'll get them answered for you.
Will do. Appreciate that. All right. Well, then the next part of our program is going to be with Val Goodwin with a presentation on regional analytics in the planning team and looking at sort of where responses have looked like, what the past year or so has looked like, and sort of visualize that a little bit. So I will hand it over to you, Val.
Thank you so much. Good morning, everyone. I appreciate all of you being here and taking the time to connect together as a team and take advantage of this opportunity to learn and, as I said, connect. For those of you that don't know me, my name is Valerie Ballard, still Valerie Goodwin via Microsoft Outlook. And I am a Senior Disaster Program Manager for Information Management and Situational Awareness, and temporarily or as an interim, also direct services. And just appreciate your time in a few minutes to share with you. I will apologize for a few things this morning. Internet crashed this morning and still a little shaky. So I will not be using my camera, just rebooted successfully for the first time a few minutes ago. Also lost a chunk of my presentation. So apologize for that, but we'll share the part that survived and reconnect and share through this meeting's chat feature later on with the part that we'll share that through chat in a link with what I had hoped to share as well. So with that, I'll share my screen. And please do, as I'm sharing my screen, if someone can watch chat, I do not watch chat and share my screen at the same time, just for focus and let's see.
I'll keep an eye out for you.
Thank you, Ari. So really, the main focus of my presentation this morning, the part that is still able to share at this point, is really focusing on our team, which is you, and in just sharing a little bit of the response data from where we have been this fiscal year so far, fiscal year 2022 to date, and just pulling data from Volunteer Connection. Here is a look at the Illinois Region Mass Care group activity and positions across the region. As you can see, there is a lot of, we have great coverage for the purpose of, there we are. So this is all of the mass care group activity and positions. I'll quickly go to the breakout for mass care purposes. This is a look at the sheltering gaps across the
Val,
region.
I think we're still just seeing the first slide.
Not seeing any scrolling.
No. Or I'm not.
You can press under the file, press the button from beginning, and you'll go into slideshow mode.
Now, are you seeing sheltering gaps?
No.
There we go. I think the internet just isn't like you today.
Are you seeing it? Are you seeing the whole? We'll do this. I know it's not visually,
fine.
yeah, visually great, but we'll go through it this way. So far fiscal year 2022, there's been 3 multifamily fire shelters that have been opened, and the sheltering team has supported. There's been 2 winter storm sheltering operations that the team has supported in coordination and collaboration, of course, with other mass care and logistics efforts. And then there's been 1 tornado response with an active shelter as well. And then several readiness activities and readiness efforts. So whenever, from a situational awareness perspective, whenever our team sends out a notice to regional leadership that there is something on the horizon that we're concerned about, Steve Weiss, Danny Portman, Ashley Randall, Ari, and others on the sheltering leadership team often send out availability requests, and the sheltering team is quick to stand up and be on the ready. And so it has been a fairly busy fiscal year, and we are about to start the 4th quarter of the Red Cross fiscal year. And so as you can see, the sheltering team has been busy, and along with if one part of our team is busy, then everyone else is as well. And so here's a look at what that has meant for those with feeding gaps and participate active in the feeding team. So this fiscal year, the first 3 quarters of the fiscal year, there's been over 1,000 meals served, over 700 snacks served. And again, that same readiness activity continues in support of the possibility of, I know from serving in different roles, we've had several multifamily fires that may have needed feeding support, and Hank and Jamie had the team ready and on alert in case it was needed. And the same with winter storm response planning and other activities. And also, if we are working that, if services are provided from sheltering or feeding or other activities such as DES and reunification, then we are undoubtedly also very busy in logistics. Here's a look at looking at the way that that's presented. It's the primary gap with logistics. And so here's a look at fiscal year 2022 to date as well. There's been multiple IRV deployments outside of the region, a lot of steady state work with inventory and fleet support and updates, but also that same work has been done to make sure that our inventory and fleet activity is tracked and supported on 6 disaster relief operations during fiscal year 2022. And that same readiness activity, whether it be supporting movement of supplies and readiness and tracking of inventory and supplies ahead of possible responses, or serving on the regional response readiness team, readiness activity and actions has been steady in the logistics team as well. One thing that is not on here is also the work and participation by all areas of mass care, and including disaster DST on several regional exercises and training opportunities that have occurred this fiscal year as well. Ari, again, this is a shorter presentation than intended with the technology crash, but I will turn it back to you and see if we have any questions.
Right. Thanks for the presentation, Val, and working through tech issues. I know how frustrating it can be to run into stuff like that. So any questions? It's been a busy year already. It's been a busy past year. Does anyone have any questions about what we've seen in the past year or anything like that? No one? Well, similar to Chris's presentation, please put any chats that you have for the planning team's presentation in the chat. We'll make sure to get back to it later. You know, at some point, I'll keep track of any questions that you might have. And in the meantime, what I'll do is we're a little bit ahead of schedule. I'll go over briefly how this virtual summit's going to work for the breakout sessions, and then to make sure that we stick within our time frame. What we'll do is we'll maybe get started at around 11 o'clock rather than 11:10, sort of push everything up a little bit. But what I want to do is, again, show what the agenda is going to look like. So what we're going to be doing is, now that we've wrapped up, I'll have Yasmin come on. She'll show a PowerPoint with clickable links for all of you to get into the various breakout sessions. The way that this will work is that we will have 5 individual breakout sessions, each one on a different topic with a subject matter experts in those. And the goal of this is there'll be some presented material, but ultimately it's about you guys asking your questions, talking about past experiences, frustrations, successes, wherever the case may be, and really looking at what would you like to know for the future, and what in the past would you like to go over and learn from. You know, the disaster seasons over the last couple of years has thrown a lot at us. So hopefully this is a chance to have a bit more of a discussion as we really prepare for whatever this year may be. You know, maybe it'll be like 2019, you know, relatively, won't say the word, but easier, or it could be like 2020. But I think with the team like we have here, we'll be well prepared. So again, really focus on that discussion. And again, the topics will be feeding with Hank Welch, Jamie Winterbaum, sheltering with Steve Wise, and Alex Rose, the senior associate with sheltering at NHQ. Disability integration with Dana Goldsmith from the Cowie or Colorado, Wyoming region, and Cindy Waters. DHS with Jan Terry and Ruth Ann. And then logistics with Sue Keel and Ron Loeffler. And with that, and then after that, we'll have a bit of a lunch break. I'll give everyone 10 minutes to go get lunch. And then after 10 minutes, you're welcome to come back for a trivia game. We'll do some quick trivia. The top 5 winners will give a randomly selected prize from whatever I can steal from the Rounder Center. That is a prize. And then I'll mail that to you. But in total, we'll get 40 minutes for lunch. And then after that, we'll go into another set of breakout sessions. The breakout sessions will be the same as the first one. So everyone gets to attend at least 2 of them. And additionally, recording will be optional within the group, again, to enhance discussion. But if you're all right with it, the person leading the sessions will record it. And that way, those of you who wanted to see from all the different sessions can see some of those recordings. Once we finish up our second breakout, we'll have a short break, and then we'll have a special guest speaker, Bridget Heyman, from the communications director from Access Living. I'll put her link in the chat during the second break for you to look over it. And then we'll have a quick review of the summit in-person trainings that are coming up, and then we'll close out. So with that said, Yasmin, I'll hand it to you for any further DST questions and review, if you can.
Sure. That would actually be Thomas, who is currently sharing the screen. So I'm going to let Thomas take over.
Okay. Everyone should see a screen right now. And so if you want to go to a breakout session, just find the link that you right there and just click on the link to join the meeting. Okay. So once you click on the link, it will take you there. And then so there's a question to ask about, can you do two sessions at one time? I don't think you should only do one at a time. But I think after lunch, there's another breakout session, then you can go to the second one. So that you have two opportunities to attend the breakout. So everyone know what to do now?
Then,
So pick a session and click on the link to join the meeting. So go ahead, Ari.
So what we'll do is, again, we'll be a little bit ahead of schedule, but I will give everyone 15 minutes. Go to the bathroom, get some more coffee. And then when you get back, we'll click on the session of your choice. The links on the screen that are being shared right now are live. If you need a link emailed to you, let any one of the DST people know and we can send that to you. And then rather than at 11:10, we'll get started at 11 o'clock on the first session. So in the meantime, I'll see you all in one of the sessions in just a few minutes. Thank you all. And then we'll have DST people hang out around in here if anyone has any questions in the meantime.
And if you have problem of going to the breakout room, you can come back to this session and then send a chat message to. Then we will see it and help you.